Psychodynamic therapy focuses on the psychological roots of emotional suffering. In general, psychodynamics is the study of the interrelationship of various parts of the mind, personality, or psyche as they relate to the mental, emotional, or motivational forces, especially at the unconscious level. This treatment focuses on resolving underlying emotional conflicts and increasing self-awareness to improve overall psychological functioning. Psychodynamic treatment plans typically involve an initial assessment to identify the patient's presenting problems, followed by a treatment plan that outlines the patient's goals and the specific strategies and interventions to achieve those goals. The plan may include therapeutic techniques such as free association, dream analysis, and transference/counter-transference analysis. These treatment plans often treat mental health disorders like depression, anxiety, and personality disorders. They are tailored to each individual's unique needs and concerns. Any mental health professional trained in psychodynamic therapy can use our printable psychodynamic therapy treatment plan to guide their treatment patients, as well as other healthcare professionals such as psychiatrists, psychologists, clinical social workers, and mental health counselors. To use our psychodynamic treatment plan, follow these steps. Download the Psychodynamic Treatment Plan off our Carepatron platform, which you can find in the description. Fill out the patient's detail in the assessment as shown on the screen. The first step is to set goals that are specific, measurable, attainable, relevant, and time-bound. Use the sample goals in the Psychodynamic Treatment Plan as a guide and work with your patient to refine these goals to meet their unique needs and preferences. Next, develop strategies and interventions that align with the patient's goals. Use the sample strategies and interventions in the Psychodynamic Treatment Plan as a starting point and tailor these to fit the patient's individual circumstances. Next, track progress. Administer the outcome measures listed in the Psychodynamic Treatment Plan regularly to track the patient's progress towards their goals. Use the sample scores provided as a benchmark, but also look for individual trends in the patient's scores over time. Adjust the treatment plan based on the patient's progress and feedback. This may involve modifying the strategies and interventions or adjusting the goals themselves. Here is a sample of our Psychodynamic Treatment Plan, which you can find on our Carepatron platform. To find our Psychodynamic Treatment Plan, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.